Hey guys, how are all of you? Okay, so let's begin the session today. And you all know that the topic for today is bone. Okay? So I'm just waiting for more learners to join and then let's begin the session. The topic that we are covering today is bone, and you all know that I have a series running called as Histology 101. All right, this series, that is Histology 101, it is meant for you guys so that I make a playlist where everything that you need about histology is there in the form of histology masterclasses, where I take up complete topics in a single short session, right? The idea is to take around 1 hour sessions almost every day so that you guys can learn histology in a regular way, and you guys will see that it is different from any of the lectures you will find anywhere for histology, for the simple reason that it is very visual. Okay, you are going to see a lot of slides. That is how I teach using slides, right? Not the slides of PowerPoint, but histology microscopic slides, right? Second thing, it is going to be comprehensive. Okay, so some places you might find that this is very detailed, but that is only to show you guys that what the proper concept is. However much you can retain, that will be good enough for you. But मतलब मैं तुम्हें अगर let's say 100 पढ़ा रहा हूँ, तो at least 70 you will retain. At least 70 you will retain, है ना? And that will be sufficient for you guys to not just pass your examinations, but also get a good rank, also get a good score. All right, and I will also not spend too much time on anything. Okay, so let's begin with Histology 101, the series. Today's Histology Masterclass is on the topic bone. So if you guys recall, we've already done one masterclass on the topic of cartilage. I'd also sent the notes for that. I hope you guys have downloaded and saved the notes for cartilage. है ना, बहुत अच्छी क्लास थी cartilage पे, सारी slides दिखाई थी, and I told you all the identification features. Now before I begin the session, there's a very special offer that's going on. As you all know that for 2021, the NEET PG entrance examination is on 12th of September. Admit cards, etc. Everything is out. Okay. So what we at Unacademy have planned is that if you take your subscription before the exam, that is on 11th till 11th of September 2021, and your subscription is 1 year or more, we have a special offer for you. We are giving you Unacademy printed notes free of cost. They will be delivered to your home, provided you are using educator referral codes, that is Chetanya 10, right? This is my educator referral code, CHETANYA10, right? So please remember to use only and only this referral code, and there are only 3 days left for this offer, so go ahead, take advantage of this offer. Essentially, if you are taking a plan that is more than 1 year, you are getting these advantages, right? You can avail a no cost EMI offer. You will get the notes free of cost. If you are taking a 1 year subscription, you will get 2 months free. If you are taking a 2 year subscription, you will get 4 months free. And on the price of the subscription, you will get a 10% direct discount. Okay, no cashback, nothing. A direct discount will be applied to your cart, and the referral code that you have to use is, the only condition is that use the right referral code, CHETANYA10, right? Although this will work, if it does not work, you can also use SPCM, Special Chetanya Mittal, right? SPCM. Okay. Hi Charu, hi Abhishek, how are you guys? And I'll also tell you about the iconic program where we are also offering prep ladder. Before that, I would like to give you a glimpse of how I teach and what is my teaching style, what is my teaching strategy. Okay, so let me show you guys the way that I generally teach in histology. Okay, so let me show you. Right, so what I will do is I will put up a slide here for you guys. I will ask you to identify it. First thing that I will do is I will ask you to identify the slide. Okay, so what can you make out here? Of course, I am teaching you bone. So you all know this is bone. You all know this is bone. Now, bone is of two types, compact bone and cancellous bone. So of course, this is going to be which type of bone? This is compact bone. This is compact bone. What you are seeing here is compact bone. I'll tell you how you identify compact bone, what are the various features in compact bone identification. And as you can make out, this is not a H&E slide. This is not a H&E slide. So the first thing that I always point out to the students is that this is a compact bone and it is a transverse section. It's not a longitudinal section. Okay, it's a transverse section. So that is something you should be able to make out. And by now, I am sure that you understand what is a transverse section and what is a longitudinal section. Okay. So if I have a cylinder, and I am cutting it in a plane that is, like this. If this is the plane in which I am cutting it, right? I should, probably slightly make it a little slanted, but you get the idea. If I am cutting it in a manner that is somewhat like this, okay? This is what is called as a transverse section. This is what is called as a transverse section. Okay, I hope you understand. And on the other hand, if I am cutting it in the other orientation, right, in the longitudinal orientation, that will be called as a longitudinal section. And I hope you understand how that will go. That will be somewhat like this. Okay, so this is how a longitudinal section is made. Transverse and longitudinal section. Okay, now I'm not drawing this here again. I'm just going to take it away. Right. So let me tell you, this is a transverse section of a compact bone. Now, what are the identification features to look out for? What are the identification features you guys need to look out for in this transverse section? Okay. So I'll give you a brief idea, and then in detail we will do when we are studying. So you can see, lamellation. You can see lamellation. So you can see what all can you make out in this section. Basically, you should be able to identify osteons. You should be able to identify concentric lamella, interstitial lamella, right? Osteocytes, and you will be able to identify periosteum. You will be able to identify osteocytes, है ना? So this cell that you can make out here, that is pointed out here. So first identification features is that it is not an HND. It is unstained section. Okay, it is not HND. So when you draw the diagram, when you draw the best identification, you will not write this point. Do not write this point in the exam. But if you want to identify the slide, you should identify that it is a unstained section. First thing is that it is a unstained section, right? It is not stained by HND. Do not write this as an identification feature in the exam, but for your own understanding, for your own knowledge, if you have to make sure that it is a bone section, just see that it is not a HND. And even when you draw it, do not draw it with a HND pencil. Draw it with a simple HB black and white pencil, well, black pencil, right? Second feature that you can write here is that periosteum is seen outside. I'll tell you what is periosteum. Apart from periosteum, you can see osteocytes within lacuna. है ना? ये भी समझाता हूँ. Osteocytes in lacunae, that is another feature you can write. Apart from the osteocytes in between the lamella, there are osteocytes in the lacuna. You have three types of lamella: Haversian, interstitial, and circumferential. Okay, three types of lamella, right? I'm writing here Haversian, circumferential, and lastly interstitial, right? So these are the three types of lamella that are going to be seen here. So this is the way of teaching histology, I believe, and this way you will understand things better. You will be able to appreciate things better, and similarly throughout the session, I will be showing you a lot of these slides, and that is how we will learn. Okay. Okay. Now, first of all, let me introduce myself. I haven't done that yet. My name is Chetanya Mittal. I am currently pursuing my MBBS from AIMS New Delhi. I am in my third year, and there's a peer-to-peer connect that I'm able to establish. What you will see is that the way I teach you, it's out of what I have learned, right? And I can connect because I understand that histology is frustrating. Jab you look at a microscope, all you see is pink and blue. So I told you here that if you are not able to see an HND slide, it means it is compact bone. So those are practical things. Those are things that will help you identify. Okay. I also teach live on Unacademy, so you can download the Unacademy Learner app. You will need an invite code to unlock free plan, okay, where you can access lots of content free of cost without taking any subscriptions, right? And for that you can use my referral code Chetanya10. Okay, you can go to my profile. I take special classes generally on Wednesday, and if you have not downloaded the PDF of my cartilage notes, which was an amazing session, you can subscribe to our Telegram channel, that is Let's Crack NEET PG. You will find messages from me there where I've sent the notes. Just search through the Telegram channel, and this is my plus referral code. So whenever you are taking any subscriptions for anything, please remember to always apply this. Now, if you're going with a 2-year subscription plan, what we have planned for you guys is that you might be in your second year right now. So for 4 months, you will be preparing for almost, let's say, your second prof. And after that, you will need 2 years for your preparation till the final prof, right? This is your third and fourth year, right? That is for which you will be preparing next. And if you are using my referral code Chetanya10 or SPCM with a 2-year plan, you will essentially get 4 months free of cost. So this is an amazing limited time offer for you guys. These are the various batches. We have new batches starting on 15th right now and 22nd also. So you can see the batches. We have batches for FMGE, we have batches for INI set, we have batches for NEET PG, right? And we have batches for next, okay, that will start from most likely 2023, okay, or 2022. So these are the various plans that we have. And apart from that, I already told you, if you go for a 1-year subscription plan, you get 2 months free of cost. And if you are currently in your first year and you want to kickstart your preparation, go with the 4-year iconic plan. It will rid you of all your troubles. 4-year, you will not have to think about anything. You will get each and everything for your preparation, including the printed notes of both Unacademy and PrepLadder for all 19 subjects. You will be sorted for your medical postings for all your university exams, first prof, second prof, third prof, final prof, right? And you will also get a 10% discount here. This will cost you 67,500. All you need to do is use my referral code Chetanya10 or SPCM while taking a subscription, right? That is very, very important. So these are the various plans, the plus, the iconic. You can also clear your doubts on Unacademy using Ask a Doubt feature. In special classes, we have options to have interactive polls, and plus users can also raise their hand and unmute their mics and ask their doubts live to the educators. Trust me, I've seen people do that and it is amazing, right? So that is the advantage of being a plus user. You can go ahead, take a subscription and experience the live experience on Unacademy from India's best educators, most dynamic educators, right? And if you go with the iconic subscription, you also get access to PrepLadder, where you are getting the video lectures, right? The question bank with active guidance and the dream notes, right? So you are getting all of this if you are going with the PrepLadder plan, and you will get the updated, very effective QBank. And these are some of our learners who had some good ranks. These were the offers I told you about. So essentially, these are the plus subscription offers and these are the iconic ones. These are the various plans. Remember, if you are taking a plan that is 1 year or above, please take it before 11th of September or on 11th of September using only and only my referral code Chetanya10 or SPCM, because you can avail no cost EMI, right? You will get 10% discount, right? Ye to milega hi milega. Apart from that, on a 1-year plan, you will get 2 months free. On a 2-year plan, you will get 4 months free. And apart from all that, you will get the notes, right? If you take plus, you will get notes of Unacademy. If you take iconic, you will get notes of Unacademy as well as PrepLadder, right? And this offer is only valid till the NEET PG examination. So let's begin with the topic of bone now, right? Let's begin a little bit properly with the topic of bone, okay? And remember, here we are doing microanatomy. We are not doing orthopedics. So we will study accordingly. And now please keep in mind the subject that we are doing. We will obviously have to stay in the confines of that subject. So we are doing bone first of all. Bone, what is bone? So we've already talked about connective tissue, right? Bone is nothing but a example of a specialized connective tissue. Remember, connective tissue, it is of 3 broad types. There is connective tissue proper, connective tissue embryonic, and connective tissue specialized. So bone, blood, lymphatic, all of this is specialized connective tissue, and so is bone. Now, why is it specialized? The reason is that you all know connective tissue. It has a few components. It is having cell and it is having extracellular matrix, which includes both fibers. So fibers here are mainly collagen fibers. Along with that, you have ground substance. Now, the reason bone is a specialized connective tissue is that this extracellular matrix, it has mineral deposition. So it is mineralized, which makes it solid and non-pliable, right? Which makes it solid and non-pliable. What are the two words I've used for bone? Solid and non-pliable. If you look at cartilage, I will say cartilage is solid and pliable. Okay, you guys have already attended the lecture on cartilage. I taught you the types of cartilage along with each and every slide. So that is the essential feature about bone. Okay, so bone consists of cells and ECM, and the distinguishing feature is that the matrix has deposition of minerals. Now, what is that mineral? Right? What is that mineral? So we say that the mineral that is deposited here is calcium phosphate. It is, so I'll write here in a proper way. You have the deposition of calcium and phosphate in the form of what are called as hydroxyapatite crystals. क्या बोलते हैं इनको? Hydroxyapatite crystal, right? So they can be fluor hydroxyapatite crystals. They can be phospho hydroxyapatite crystals. They can fluorohydroxyapatite, hydroxyapatite crystals, right? So you have calcium phosphate and hydroxide. A complex बनता है, right? So I will just write the formula here if anybody of you wants to understand what is hydroxyapatite. ऐसे ही fluoroxyapatite भी होता है, which will have fluorine in it, right? But it is basically nothing but calcium phosphate. So you have calcium phosphate, right? And to balance the charge, you also have two molecules of hydroxyl, right? This is hydroxy, right? Okay, the chemical formula. Now, because of that, because it has calcium and phosphate, so one of the important features that bone has apart from your support, your skeletal system, is that calcium and phosphate levels, right? Calcium and phosphate, bone has an important role. Bone has an important role when it comes to homeostasis of calcium and phosphate, which is very, very important for your body because these two ions, they are having lots of disorders associated with them, right? So calcium phosphate, I'm writing homeostasis. Okay, done. So bone has a very important role because it allows for storage, mineralization, demineralization. Now, what was the type of collagen? What was the type of collagen in bone? Does anybody of you remember? So I was writing, remember, fibers. When we are talking about fibers, always remember that here you are having collagen fiber. What is the type of collagen fiber? In bone, right? So you write bone, B-O-N-E. So just look at this one, right? So it has type 1 collagen fibers. It has type 1 collagen fibers. So I'm just specifying here collagen type 1, just for clarity, right? Collagen type 1. And then you can have some, it is almost 90% of the bone matrix is collagen. You can have some other substances, okay? Now, ground substance, it is non-collagenous. Now, ground substance, it is non-collagenous, okay? Now, non-collagenous, you will have proteoglycans, okay? Glycosaminoglycans like keratin sulfate, okay? Then you will have some glycoproteins. Then you will have some special proteins like osteocalcin. ठीक है, ऐसे कुछ कुछ प्रोटीन्स होती हैं, ऑस्टियोकैल्सिन, ऑस्टियोनेक्टिन, ऑस्टियोपोंटिन, ऐसी कुछ कुछ ऑस्टियो वाली प्रोटीन्स होती हैं, right? That is present. Then apart from that, there are certain proteins like BMPs, bone morphogenic proteins, okay? So they are also present. So what I'll write here is that ground substance, there are non-collagenous proteins. Other proteins including glycoproteins and glycosaminoglycans, right? So I'm just writing that here. Okay. After that, the bone matrix, it is nothing but it contains lacunae. It contains lots of lacunae, right? And these are spaces, and every space contains a single bone cell called as a osteocyte. It contains a single bone cell called as an osteocyte. So I'll just show it to you. Just give me 1 second. Right. So you have a lacuna of sorts. Okay, I'm drawing it incomplete. I'll tell you why. Inside that you have a cell that is basically a osteocyte. Now these osteocytes, they have fine processes extending from them into the lacuna like this. Okay. Okay, that is somewhat the orientation I'm trying to develop. So what do you understand? You have certain lacuna which contain cells called as osteocytes with some fine protoplasmic processes. They have some fine protoplasmic processes. Now these fine protoplasmic processes that are, going out, these tunnels, there are certain tunnels here, and these tunnels are called as canaliculi. These tunnels are called as canaliculi. So you have a network of lacunae and canaliculi, right? And in the lacunae you have osteocytes, right? So you have a network of canaliculi, lacuna, and throughout the mineralized tissue or of bone, you have a lot of cells which are connected, right? Which are connected, and of course you will have gap junctions in between. Okay, so now whenever you talk about connective tissue, we've always talked about the types of cells, the types of fibers. So in bone also, let's talk about the various types of cells. Of course, first type of cell is osteocyte. There is no doubt about that. Apart from that, you have certain other cells. First is osteoprogenitor cells, right? They are stem cells, osteoprogenitor cells, right? Now osteoprogenitor cells, once they get differentiated to form bone, they are going to develop into osteoblasts. They are going to develop into osteoblasts, and then osteoblasts, by dividing, they are going to give rise to osteocytes. Osteoblasts are also secreting extracellular matrix, and they are converting to an osteocyte, right? I will just tell you what that means. Apart from that, you have certain cells called as bone lining cells, right? And they remain deposited around the bone once the growth is complete. So let's call them bone lining cells. And lastly, you would have heard of bone eating cells, also called as osteoclasts. Bone eating cells, also called as osteoclasts. So there are essentially 5 types of cells in bone. Osteoclasts. Osteoclasts are very important. They are called as bone eating or bone resorbing cells, and they are very important in the remodeling of the bone. So what happens is osteoprogenitor cells, they give rise to osteoblasts. Now osteoblasts, during their active growth, they give rise to osteocytes, or they can also form bone lining cells, right? Now please remember what happens. See, this is an osteoblast. This is a osteoblast. Okay. Now an osteoblast, during its development, it starts to secrete extracellular matrix around itself. It starts to secrete extracellular matrix around itself, right? So I'm writing here, secretes extracellular matrix. And once the matrix gets deposited around the osteoblast, it gets converted into a osteocyte. So an osteocyte is nothing but a osteoblast which has deposited matrix around it, deposited extracellular matrix around. So I'm just writing here for the record that this becomes a osteocyte. So this deposition takes place around. That is how this conversion happens. Fine. Okay. So now these are the cells. So osteoprogenitor cells, they give rise to osteoblasts, and on osteoblasts, they are ultimately becoming osteocytes. Now what are osteoclasts? Osteoclasts, they are going to eat the bone. So they are nothing but phagocytic cells. They are nothing but phagocytic phagocytic cells, right? Now, how are they derived? How are they derived? It is very, very interesting, right? Very, very interesting. Very, very interesting. Okay. So it is sort of like a macrophage of the bone. Am I right? It is sort of like a macrophage of the bone. So in the bone, you have bone marrow, right? In the bone, you have bone marrow. You all know inside the bone, you have bone marrow. And bone marrow, it gives rise to blood cells. It gives rise to blood cells. So they are called as hemopoietic progenitor cells. Hemopoietic progenitor cells. So I have to yet to talk about blood formation in detail. But if you look at hemopoietic progenitor cells, there are different lineages. Some will give rise to neutrophils, some will give rise to lymphocytes, some will give rise to macrophages, some will give rise to monocytes, right? So in the bone marrow, if you look at the hematopoietic progenitor cells that gives rise to a neutrophil and the one that gives rise to a monocyte, right? Cells of both these lineages, they combine, right? And what is formed here is osteoclast, which is a phagocytic cell. If you remember that neutrophils can also perform phagocytosis and monocytes are nothing but macrophages of the blood. So they can also perform phagocytosis. So when you combine both these phagocytes, you get a super phagocyte, that is the osteoclast. Okay. Now, let's talk a little bit about bone. Let's talk a little bit about the structures in the bone. Okay. शुरू करें? So now, if you remember, I told you about the sections of the bone. So this is a compact bone, transverse section. Now I told you that it is unstained, it is not having H&E. Okay. So these are called as ground sections. These are called as ground sections. क्या बोलते हैं इनको? Ground sections. What does this mean? That you do not perform any fixation and staining. Right? You do not perform any fixation and staining, but you are only cutting the bone and you are allowing it to dry. You are allowing it to dry. So you are not using any special staining techniques, right? Then these slices are cut to a very small, thickness so that you can view it under a light microscope. Okay. Sometimes some people, they can use certain stains like India ink for these ground specimens, right? And the other way is to you simply put the ground specimen on a slide and you have a medium that is going to remove the air. Okay. Okay. Now let's try to identify some of these ground sections. So basically what happens in a ground bone is all the organic material gets removed, right? The cells, the vessels, and what remains is essentially the inorganic components. What remains is the inorganic component, because in the processing that we do, we are losing everything else. Okay. So let me help you guys identify the section a little bit. Okay. Now, what is this that you are looking at? What is this that you are looking at? Again, this is a section of compact bone. It's a transverse section. And it is probably at a low magnification, probably 4x or 10x. Okay, it's a transverse section. It's a ground section. Okay, इसको कहते हैं ground section. And what can you make out here? You can make out certain canals here, right? You can make out certain round canals. They are nothing but what canals? They are Haversian canals. They are Haversian canals. And if you remember a little bit from your class 11, class 12, right? For connecting two Haversian canals, you have what is called as a Volkmann's canal. You have what is called as a Volkmann's canal. So you can label it as Volkmann's canal, also called as perforating canals, right? Volkmann's canals, right? You can appreciate that in this particular section. Okay? So that's the first thing that you need to identify. Now, if I help you guys identify some more things, let's try to do that. Okay, let's try to identify some few more things. And maybe that will help us in identifying these slides a little better. So let's look at this one. So this is again compact bone. Now you can make out a Haversian canal, you can make out a Volkmann's canal. That's the first activity I want you guys to do. Right, first of all, write it here. This is a compact ground bone in TS, right? This is let's say this is a Haversian canal. So I'm writing just H here for Haversian canal. This is H. And if you look at it, if this is H, just have a look at this. This is a Volkmann's canal, which is a transverse canal, also called as a perforating canal. So I'm writing H and V. Okay, let me draw this with a different color so that you. Okay, now what is the new thing that you can make out here? Can you make out this appearance? I say you can make out this appearance. What is this unit that you can make out around a Haversian canal? What is this unit that you can make out? Any idea? Anyone has any idea? So I'm going to take this one for your example. This is nothing but a osteon. I will tell you what a osteon is, but for now please note that this is a osteon. You should know this, that this is a osteon for a compact bone. So Haversian canal, Volkmann canal, you should be able to clearly identify. You should also be able to identify osteon. Okay, so I will tell you, compact bone, there are cylindrical units. In a mature compact bone, let's write the identification features here. This is important. Okay, so you are having what? First of all, features that I told you here, that it is unstained, there is it's a ground slide, right? Then you can appreciate osteocytes, there are lacuna, there are lamellae. Okay, so let's talk a little bit more practically. First of all, you will be able to see mature compact bone, and there are cylindrical units called as osteons. There are cylindrical units called as osteons. Now these osteons, they are also called as Haversian systems. That's something that you should know. है ना? इसको क्या बोलते हैं? Haversian system. And it is only seen in the bone of mammals. So it is present for humans, right? No doubt about that. Now, second feature that you should be able to appreciate here is, in all of these, the osteon, there is a central Haversian canal, and around that you have concentric lamella. So you will write here osteon, there is a central Haversian canal plus concentric lamella, right? Surrounding it you have a lamella, which is basically nothing but concentric lamella, right? Concentric lamella. Now in between two osteons, right, there are interstitial lamella, and along the entire shaft of the long bone you have circumferential lamella. So I will tell you later on what are these lamella, but for now just note down interstitial. I will show you interstitial, and I will also show you circumferential lamella. Interstitial lamella and circumferential lamella can also be appreciated. So three types of lamella I told you: interstitial, circumferential, and concentric, that you have already seen. This again I will show you. Do not worry. Okay. So interstitial lamella and circumferential lamella. Then you have perforating canals or Volkmann canals, which are transverse canals connecting periosteal surfaces of two osteons. Connect two osteons, right? So please write perforating or Volkmann's canals, right? Interconnect osteons. That is another feature of identifying, right? You can be asked one more feature, that is there is presence of osteocytes within lacuna that you might or might not be able to see. Okay, so let me show you some more images so that you can appreciate everything I've just told you. Okay, so aversion canal, Waxman canal, that is clear. I don't think I need to show you that. Concentric lamella is also clear to you. Nah? Concentric lamella, I don't need to show you again. Okay, so just let me give you a magnified view of the same image. Right, so this is nothing but an osteon. In the center, you can see an aversion canal. Right, so I will just label here aversion canal. And what you see around this is concentric lamella, which is nothing but a lamellar deposition of matrix, extracellular. This is nothing but extracellular, right? Concentric lamella. You can see that. Apart from that, if you want to try and make out interstitial and circumferential lamella, let's try and do that. Now, first of all, let's take a good section. Okay, now I have a pointer wali slide with me, right, where my focus is on interstitial lamella. So you can make out this is one Haversian canal, this is one Walkman's canal that is going here, right? This is a Haversian canal, and here also you have a Haversian canal in the slide, right? Now these are two different osteons with their own circumferential lamellae, right? So between the circumferential lamellae, let's say the circumferential lamellae, they are going till here. This region is what? This is interstitial lamella. This is nothing but interstitial lamella. So I'm just going to label it as okay, so I'll just label it as interstitial lamella. Okay. What else are you guys left to see? You have seen Walkman's canal, Haversian canal, interstitial lamella, concentric lamella. You've seen an osteon. Now, I hope you can appreciate where are the osteocytes, right? So in these lamella, you have the matrix. So in the center, wherever you are able to see these lacuna, these are osteocytes. Now, this is where osteocytes will be found, right? These are the lacuna. So these are osteocytes, and around them they are depositing matrix, right? And in the center you have a Haversian canal. Some people get really confused. They will think that this is the lacuna, right? If you are looking at a bone, some people will say, yes, we can see a lacuna. This is not the lacuna. This is a Haversian canal. Okay, this is not a lacuna. Please do not make this mistake. This is not a lacuna. Okay, do not make this mistake. So just for your clarity, I will write it. This is not a lacuna. It is a Haversian canal, right? Which is a lacuna? This is a lacuna. Okay, is this clear? So guys, here we will take a 5-minute break, 5-10 minute break, and then we will restart from here. So in case you guys have any doubts, you can no doubts. Okay. So apart from that, the third type of lamella is circumferential lamella that will be present along the shaft of the bones. That will be present along the shaft of the bones, right? So that is again something for you guys to understand. Okay. So any doubts with regards to this, everything that we have done so far? Any doubts here? Okay. So now in bone, this is the ground section that I wanted to show you. This is the lamellae that I wanted to show you. इसके बाद आगे जाके आगे कुछ developing bone वगैरह की slides आएंगी. Now before I go to developing bone, show you bone marrow cavity, I want to show you some other sections. But before that, I will have to tell you a little bit about the types of bone. Before that, I will have to tell you a little bit about the types of bone. मैंने although compact bone तो मैं पढ़ा दिया है, I have not told you the difference between compact bone and spongy bone just yet. Okay, so let's go back to understanding that first, and then we will come back here. Okay, करें शुरू दोबारा से. Now bones. First of all, my question to you is that what is bone? You all know that you have tissue. So is bone a cell? Of course, bone is not a cell. Is bone a tissue or is bone a organ? If I'm looking at a bone, is it a tissue or is it an organ? Is bone a tissue or an organ? Bones are organs. Bones are organs, and together they are forming which system? Skeletal system, right? So bones are not tissues. In fact, there is a separate bone tissue that is forming the structural framework of a bone. So bone, when you say bone, it is an organ which is forming the skeletal system, right? Apart from that, you will of course have blood vessels, you will have nerves. All of that is going to be the tissue that is forming the bone as a organ, right? A bone as an organ, it is having bone tissue and it has other connective tissues like fat. Okay, bone marrow, it has a lot of adipose tissue, it has hematopoietic tissue, it has blood vessels, it has nerves, right? So it has all of these. Okay, and if the bone, it is forming a joint, on top of it you will also have cartilage, you will have hyaline cartilage, right? You will have hyaline cartilage. Now bone tissue, it is of two types. So bone, it is an organ, so it must be made up of multiple tissues. So if it is an organ, it is made up of bone tissue plus other connective tissue, including blood vessels, including nerves. Sorry, so this is nervous tissue, and then you have adipose tissue, right? Apart from that, you have hematopoietic tissue, right? All of these are going to form bone as an organ. So it is a combination of multiple tissues. Now, when you talk about bone tissue in particular, it is of two types, right? You have two types of bone. One is called as spongy bone. The other is called as compact or cancellous bone, right? There is either compact is also called as dense, spongy is also called as cancellous. So you have either compact bone or spongy bone. Okay, so these are the most commonly used terms. Compact is also called as dense. Spongy is also called as cancellous bone. C-A-N-C-E-L-L-O-U-S. Cancellous bone. Right? So these are the two types of bones. So if you cut, so how do you identify this? You identify this on transection. If a bone, when you cut it, there are different arrangements that can be recognized. Okay, if you look at a longitudinal section, you can see two types of configurations. Okay, so I will just show you how to identify with this. Just let me show you. Okay, so if you are looking at bone, if you have a bone set especially, okay, I want you guys to appreciate this in that. I want you guys to appreciate it in a bone set. You should be able to appreciate. Okay, this is how this is an interface that I'm showing you. If you look here, there is a distinct demarcation that you can make out. Okay, which do you think is spongy? Which side do you think is spongy? Of course, this side here is spongy bone, and this side here you have dense or compact. Okay, so you can make out that there are, how do you identify? So spongy bone, you can make out that there are trabeculae. These are trabeculae. Okay, when you are looking at the bone, the configuration is spongy, and there are bony trabeculae. Okay, bony trabeculae, and in between them you have marrow spaces. In between them you have marrow spaces. Where you have marrow spaces basically means you have bone marrow is present there. Okay. So here, of course, you know which marrow we are referring to. Okay. So you are talking about bone marrow. Okay. And the so this is how this trabeculae are oriented. This is how trabeculae are oriented. Now, the outer portion that you see here, there is a solid structure. There is a solid structure. Okay. So this is called as compact. It is, of course, more dense. Solid, you cannot appreciate trabeculae. You will be able to easily make out once you are familiar with this understanding. Okay. So these are the two types or the two patterns of bone. So the compact bone is second thing that you can understand is that it is present outside. It is present towards the outside. So I will also write that as a feature. It is present towards the outside of the bone. Okay, it is present towards the outside of the bone, whereas the spongy bone, it is present in the interior. It is present in the interior, right? Present in the interior. Okay, and if you look at these spaces here, for example, these spaces here that you can make out. So if the bone, this is of course a dead bone. So if you are looking at a living bone here, you are going to have bone marrow and blood vessels. Okay, that is what is going to happen. Now, there is another classification for bones. You have spongy bones and you have compact bones. Apart from that, you have four classifications of bones, right? Again, now this is sort of, a correlation between your general anatomy and your histology. So I will write here. According to your general anatomy, there are four major types of bone. Okay. You have long bone, right? You have long bone. Then you have short bone. Then you have flat bone and irregular bone. It's based on the shape, based on the shape, based on the structure. These are the four types of bones: long, short, flat, irregular. ठीक है? Then there are short long bones. ऐसा भी होता है ना, कुछ कुछ चीजें ऐसी होती है. So long bones are basically those bones in which you have a very long shaft, right? So they are long. That's why they're called as long bones. And you can get the schematic diagrams of long bones, short bones, flat bones. Flat bones include like the bones of the skull or the sternum, right? And irregular bones, they don't have a well-defined shape. For example, vertebra, right? They have a very complex shape, okay? Or the ethmoid bone, okay? And in this, if you talk about your general anatomy portion, you should know what is diaphysis, epiphysis, and metaphysis. Okay, so I'm just writing it here. You should know diaphysis, right? That is the shaft of the bone. Epiphysis, that is the end of the bone. Metaphysis, where you have the formation of the metaphyseal plate. And inside the diaphysis or the shaft of the bone, you have a large cavity called as the medullary cavity. You have a large cavity called as the medullary cavity, surrounded mainly by compact bone. Surrounded mainly by compact bone. So you have a marrow cavity or a medullary cavity, right? So in the diaphysis, almost all the bone is compact bone, and in the center you have marrow cavity, right? Whereas towards, if you look at the epiphysis, you have more spongy bone as compared to compact. Okay. So let me just write it for you here that in the epiphysis, in the diaphysis, the compact bone is more than the spongy bone, and in the epiphysis, the spongy bone is more than the compact. Okay. So that is another thing. Okay. Any doubt? Okay, now let's talk about the covering of bone. Let's talk about the covering of bone. So bone as an organ, it has bone tissue, and that bone tissue, it is surrounded by, okay, let's say this is here. Okay, so let's say this is here is the, what you can make out here, this is the bone. So outside the bone, right? This region that I've shown in green, this is called as periosteum. This is called as periosteum. Now, why is this called as periosteum? Right? Remember, in cartilage you have something called as perichondrium. Right? So bones, you have a covering called as periosteum, which is dense, collagenous or fibrous connective tissue, and it contains cells called as osteoprogenitor cells. It contains osteoprogenitor cells. Contains osteoprogenitor cells. Right? And remember, the cartilage, you did not have any blood supply. Inside the cartilage, you did not have any blood supply, whereas in bones, you have a very rich supply of blood. Now, bones, they are covered by periosteum, except at the sites of articulation. Except at sites of articulation. What do you have at the site of articulation? You are having hyaline cartilage. Remember, articular cartilage is made up of hyaline cartilage, right? So I'm writing here hyaline cartilage. So that is about periosteum and a hyaline cartilage. Okay, periosteum, it is similar to perichondrium. Okay, it is similar to perichondrium. Remember, perichondrium had an outer fibrous layer and an inner cellular layer, right? So it has a outer fibrous layer. It is also divided into, just like the perichondrium, it is divided into outer fibrous layer and inner cellular layer. The outer fibrous layer is made up of dense fibrous connective tissue, and the inner cellular layer is made up of osteoprogenitor cells. It is made up of osteoprogenitor cells. ठीक है? So I'll write it in this way. Over dense fibrous connective tissue, I will write outer fibrous, and here I will write inner cellular. Right? Inner layer is cellular. Similar to what you had in perichondrium. Similar to what you had in perichondrium. Okay? If the bone, it is not undergoing growth, then you will not have the inner layer. Then you will not have inner layer. Okay? Any doubts? Okay. Now, what I just told you, please try to understand. This is not exactly how bone is, right? Just like I told you that inside you are going to have the bone marrow cavity. Inside you are going to have the bone marrow cavity. So similarly here, when I write bone here, you have an outer layer and you also have an inner layer. You also have a inner layer. Put it here. Let's say I put it here. And let me fill it with. Okay. So now this layer automatically becomes the, this layer here, this automatically becomes the, select an outline that you shade. This layer that I made with blue, this becomes the endosteum. This becomes the endosteum. So outer covering is called as periosteum, inner covering is called as endosteum, and it is usually one cell layer thick. One cell layer, right? And that is usually osteoprogenitor cells. That is the reason why growth in bone is bidirectional. So lining tissue of compact bone and trabeculae of the spongy bone, they are forming the endosteum. Okay, it is single layer consisting of osteoprogenitor cells. It has osteoprogenitor cells, right? So osteoprogenitor cells, they are going to be found, and they are called as endosteal cells. They are called as endosteal cells. Okay. Now what happens apart from that, in the center, if you talk about the marrow cavity, so I'm writing it as the marrow cavity or the medullary cavity, right? Marrow cavity or the medullary cavity. So let me mention here marrow cavity equal to medullary cavity or marrow cavity. है ना? Now please remember that when the child is small, there's a lot of blood synthesis that occurs, and at that point in time, you have what is called as red bone marrow. What you have is red bone marrow, right? Now red bone marrow, it has mainly, it is made up of hematopoietic blood cells, right? You have hematopoietic precursors, right? And they are arranged in a network of reticular fibers. They are arranged in a network of reticular fibers, right? As the child grows older and the bones start to grow, the red bone marrow, it does not grow in proportion, right? With age, it gets replaced by adipose tissue, replaced by primarily adipose tissue, right? Not entirely, but partially. Okay, because the bone, it keeps on growing, red bone marrow, it does not grow as much. So you have the formation of yellow bone marrow, which is also a bone marrow cavity, but there the main component is adipose tissue rather than blood cells or blood precursors. That is called as yellow marrow, right? And if there is extreme blood loss or if there is any sort of an anemia, the yellow bone marrow, it can convert to red marrow. Okay, so this transformation, it is reversible. This transformation, it is reversible based on need. Based on need, can be reversed. Okay, if somebody loses a lot of blood and they need a lot of, red bone marrow, so they can convert their yellow bone marrow to red bone, right? In the adult, red bone marrow, it is restricted to spongy of some very specific locations such as the iliac crest, the sternum. Okay. Now let's understand the mature bone. Let's understand. So now bone tissue, it is of two types. Bone tissue, it is of two types. Mature bone and developing bone. Excellent. ये सारा जो मैंने तुम्हें पढ़ाया ना, पढ़ेगा. Okay, and let's talk about mature bone and developing bone. So mature bone is what I just showed you, right? Now the characteristic of mature bone is that it has osteons or Haversian systems. It has osteons or Haversian systems, right? Something that I've already explained. There is a central canal called as a Haversian canal, around which you have concentric lamellae, right? Interconnected to each other by transverse canals called as Ropeman's canal, where you have interstitial lamellae, and circumferentially you have the presence of circumferential lamella, right? Osteocytes, they have protoplasmic extensions traveling in tunnels called as canaliculi, and these canaliculi, they are forming a network of canaliculi, right? And all of these canaliculi, they open into the Haversian canal, and that allows the passage of blood from the osteocyte to the Haversian canal, and from the Haversian canal to the osteocyte. Okay, interstitial lamella, they are nothing but remnants of previous concentric lamella, right? And because of this lamellar arrangement, mature bone, it is also called as lamellar bone. It is also called as lamellar bone. Okay. Okay, so can you tell me histologically, is there a difference between mature spongy bone and mature compact bone? Is there a difference? Absolutely not, right? So bone tissue of mature spongy is exactly the same as that of mature compact. The only difference is in the arrangement. Only difference is in the arrangement, right? In case of spongy bone, this bone tissue, it is arranged as trabecula, right? It is arranged in the form of a network called as trabecula, right? Trabecula, right? Which is interspersed with bone marrow, mainly red bone marrow. And in compact bone, you have a rather dense arrangement where they are closely packed. There are no spaces in between. There are no thin anastomosing trabeculae. You do not have spicules or trabeculae, right? Trabeculae are also called as spicules. Now, and I think this image helps you really understand what is happening, right? You can understand what is spongy bone. Okay, but if you look at the cross section, they're both the same. They both have Haversian canals, they both have the lamellar structure, right? It's not that it is only present in compact bone. Okay, both have lamellated. Okay, now two more things here that you will understand is the someone might ask you, so there's a point here in general anatomy that you have to learn. Okay, and I expect you will learn it at that appropriate place. ठीक है, जनरल एनाटॉमी का 5 मार्क्स का क्वेश्चन होता है. ब्लड सप्लाई ऑफ डेवलपिंग बोन एंड मैच्योर, ये करना है आपको, है ना? दिस यू हैव टू डू व्हेन यू आर डूइंग जनरल एनाटॉमी. आई एम नॉट टीचिंग इट टू यू हियर इन histology or microanatomy. Okay, you will do it when you are doing general anatomy. One point I will tell you here is that blood supply of bone, it is essentially centrifugal. That means that it is from the center going outwards, right? Centrifugal. Okay, and when you study this in detail, you will understand why I am calling it centrifugal. Okay. Now, apart from the, I've just talked right now a lot about mature bone. So I guess you guys will want to see some slides. You guys want to see some slides? Proper slides of bone. Right. So let me show you some. Okay. Now these are actual microscopic slides. So please make sure that you guys grasp what I am showing you. Okay, now please remember these are also very similar to what I just talked to you about. These are ground sections. These are ground sections. What are they? Ground sections. Okay. So let me show you a few things here that are, seen here. So you can make out this is a perforating canal or a Volkmann's canal. ना सोनी का वॉकमैन आता था ना, ऐसे ही this is Volkmann's canal, and it is connecting to Haversian canal. So you can see this is a Haversian canal. Please note this is not a lacuna. This is not a lacuna. It is a Haversian canal. Where do you think you have the lacuna? So around the Haversian canal, you have this unit that is called as a osteon. You can clearly make out what is a osteon here, right? This unit is called as a osteon or a Haversian unit, right? And inside the osteon, arranged in these rings, you have osteocytes within lacuna, right? And the extracellular matrix around them is what? What is it called as? Concentric lamella. Concentric lamella. Okay. And what you can see in between here, right? For example, this lamella here in between, right? Where you don't have a Haversian canal surrounding it. This is nothing but interstitial lamella. Right. So my idea is to show you everything in 2 or 3 different ways, so that जिस भी वे में examiner question पूछे, image based question आए, जैसा भी question आए, you guys are able to identify. You guys should be able to identify. Okay, that's the main idea. Okay. और different type का एक देख लो. So this is again the nothing but the, you want to see the Haversian system here. Okay, you are able to make out osteons very clearly. You are able to make out concentric lamellae very clearly. You are able to make out interstitial lamellae very clearly. Right? And you can see where are the lacuna, where are the osteocytes, right? This is a Haversian canal, right? I just label everywhere Haversian canal, Haversian canal, Haversian canal, Haversian canal. ना ऐसे प्रॉपर हिस्टोलॉजी बुक्स देखोगे अच्छी वाली, तो उनमें ऐसे लेबल करते हैं स्लाइड्स को. They are going to write the labeling inside the histology slide itself, so that it's best to identify. And then where you need some small arrows, you can draw, right? So for example, this single cell that you see here, this is a osteocyte. Okay. Hi Swaroop, how are you? Good to see you here. Okay, any other doubts that you have so far? If not, we can start talking about developing bone or immature bone. Okay, so let's go and let's talk about immature or developing bone. Immature or developing bone. Now, immature bone, it does not have an organized lamellation. That is why it is also called as non-lamellar. Sorry, non-lamellar. Also called as a bundle bone. क्या बोलते हैं? Bundle bone or a bundle bone or a woven bone. Right? It is also called as a woven bone. Okay, is that clear to you all? It is called as a non-lamellar or a bundle bone or a woven bone. Right? These are the three words that can be used because of the arrangement of the collagen atoms. ठीक है? Now, what are some important features that you should understand between a immature bone and a mature bone? So, first of all, first feature is the cellularity. If you compare, does an immature bone have more cells or does a mature bone have more cells? What do you think is the answer? Immature versus mature bones. An immature bone has more cellularity as compared to a mature bone, right? Immature bone, it has more cells. Now, cells here in the immature bone, they are having a random arrangement. The problem is they are having a, not a problem per se, but the difference is they are having a random arrangement. Whereas in case of mature bone, they are having a much more regular arrangement. What about the matrix? The matrix of the immature bone, it has more ground substance. If you compare the ground substance, it is much more in case of immature bone as compared to a mature. Okay, ground substance is more. Okay, now if I ask you a question, extracellular matrix of bone stains more intensely with. Okay, I'm giving you two options. Okay, what's your answer? राइट आपको एग्जामिनर ने ये भी बता दिया एसिड कौन सा है और बेस कौन सा है. So if it is an acidic, if it is acidic, it is likely to have what kind of a charge? ठीक है, again we are going back to the basics. This is having a negative charge, so it will attract whatever is having a positive charge. If it is a base, it is likely to have a positive charge here, so it will attract if there is a negative charge present. है ना? So I just told you something about this ground substance, है ना? So if you remember, extracellular matrix, it is made up of two components, fibers and ground substance. You all know fibers, they are appearing pinkish or they are acidophilic, they are eosinophilic. Fibers are, for example, collagen, है ना? इसमें कौन सा होता है? collagen type 1 होता है. This is clearly eosinophilic. Now ground substance, it has proteins, it has other proteins, right? For example, glycosaminoglycans, right? And they are highly having negative charged because of presence of sulfates, right? I told you about keratin sulfate. So they have sulfates, right? Example, I'm writing here keratin sulfate. So because of this reason, ground substance, it is negatively charged. So therefore, because it is negatively charged, it will be attracted to positive. So it is going to stain basophilic. It's going to stain basophilic. So now you can make out that extracellular matrix of bone stains more intensely with hematoxylin in case of which bone? Okay. So remember, in mature bone you have more fibers, and in immature bone you have more ground substance. Okay. I just told you this point here, that ground substance, it is much more in immature bone as compared to mature bone. So immature bone is going to stain basophilic. So let me just write it here, immature bone. And that is a very, very important differentiation. Very, very important. Conceptually very important. Now, also mineralization is less here. Of course, you understand immature bone is having less mineralization. Okay. Now, what I want you to understand is that in the adult, do you have immature bone? Of course, you have immature bone in the fetus. Of course, you have immature bone in the fetus. Where in adult do you have immature bone? Immature bone in adult. Where do you think it is found? Okay. So why do you think a dentist put braces, right? Why do you think a dentist put braces? The reason is that immature bone, it is found in alveolar sockets of the oral cavity. Alveolar sockets of teeth, right? And it is also found in the places where tendons insert. Now, these are the two places in the body where you will have immature bone, where you will see immature. Okay, rest mostly you have mature bone. Right? Any doubts so far that you guys have? Any doubts? Okay, one thing I forgot to tell you is how to identify the various cells in the bone. ओके, एक दो क्वेश्चंस अगर एक्सपेक्ट करते हो इसमें, so I will write a few points here. Osteoprogenitor cells, they are simple to the cells of your squamous epithelium. They are similar to the cells of your squamous epithelium histologically. So osteoprogenitor cells, they are also present on the outer layers. They resemble the periosteal or the endosteal cells, right? And they are flattened or squamous cells. They are flattened or squamous cells. That's the very important thing. Okay. और भी पॉइंट्स होते हैं बट ओनली वन दिस मेन वन पॉइंट आई वांटेड टू राइट हियर. ठीक है. Osteoblasts, you all know about osteoblasts. So it is similar to fibroblast or similar to a chondroblast. Osteoblast is just a different type of a fibroblast, right? And it secretes your collagen, secretes the collagen, right? So that's very important. Any doubts so far? Now about the osteoblast, I will tell you two or three things. Now, the osteoblast, it secretes an enzyme called as alkaline phosphatase, right? So, we do histochemistry here, and it is positive for alkaline phosphatase, bone alkaline phosphatase. You can identify this. Okay? So, that is one point I wanted to tell you about osteoblast, about an enzyme called as alkaline phosphatase. So, you have a very strong reaction with alkaline phosphatase. Okay, and the role is during the deposition of bone matrix. ठीक है. And when osteoblasts, they later are surrounded by matrix, they are called as osteocyte. Okay, they will be found within canaliculi. Sorry, they will be found within lacuna, and they will have extensions called as canaliculi. चले आगे. Last cell that I want to tell you a little bit more about is osteoclast. I want to tell you a little bit more about osteoclast. Now, osteoclast, similar to the osteocyte, they are also found. They are, first of all, they are very large cells, very large cells, right? Very large cells, and the differentiating factor is that they are multinucleate. Very important factor for their identification is that they are multinucleate cells. They have multiple nuclei. That is one factor. Okay, and because of their activity they form a lacuna around themselves that is called as Howship's lacuna or resorption bay. Okay, ये question पीएमटी के टाइम भी पढ़ते थे. Osteoclasts are found in house ships, lacuna or resorption bay, right? Because they are eating the bone around them, they are by default existing in a lacuna. They are found in a lacuna around them, right? ठीक है. And it is positive for acid phosphatase. Okay, thank you Aradhya for that thumbs up. Okay, now do you guys want to see an osteoclast? Do you guys want to see an osteoclast? So this is somewhat what the osteoclast looks like. Okay, चलें आगे. Now, during when you are studying physiology, you will study the mechanism of how an osteoclast works. There are very important molecules here called as rank, right? Receptor activator of nuclear factor kappa B, rank, and then there is a rank ligand. So there is a rank ligand signaling mechanism, and there is another regulator here called as osteoprotegerin, right? Okay, so there are these three molecules are very important when you talk about osteoclasts. Okay, and it's also related to a lot of diseases, so it's also clinically significant. So you will study about this, do not worry. And so these osteoclasts are important cells here. Okay, that's why I've gone a lot of detail about osteoclasts. Okay, and then the hormonal regulation, it will come when you are talking about the physiology. Okay, now I don't want to go into bone formation. There is a a single slide that we show for bone formation, right? And with regards to endochondral ossification and the growth of bone, so I will try to cover that in a separate lecture, right? What are the various zones that are formed there? Okay, so we'll have a separate lecture for that, and I think that's enough for this session for today. Thank you so much, Aradhya, for your amazing comment. And we'll try to end this session here so that it does not become too long also. And we'll do in a separate session. I'll just write here. In a separate session, we will talk about bone formation. There is a slide for it also. Bone formation and endochondral ossification. There are some layers that you have to understand here, some zones that you have to understand in endochondral ossification, zone of reservoir, zone of cartilage, etc. Okay, that we will cover in a separate lecture. Thank you so much, Aradhya. I'm glad you are liking these sessions. And if you are liking these sessions, please remember to hit the like button. And I will just stop the video from streaming. Please remember to drop a comment so that the video has better reach. And do share it with all the friends in your college. And you can ask them to also download the PDF. It's available on our Telegram channel, Let's Crack NEET PG. And you can also subscribe to the YouTube channel and follow the playlist Histology 101, or the name of the playlist is Histology Masterclass, right? So you can also follow this playlist on our own application. So if case you guys are taking a subscription, you guys please remember to use the referral code Chetanya10. These are the spellings CHETAN, right? Chetanya, right? That's the spelling. That's my name. And 10 is the extra discount that you get. And that's not the only offer that is there. If you are taking it before 11 September, go for the plus subscription for 1 year or above with my referral code. You will get all of these advantages. You can avail no cost EMI. You will get notes absolutely free of cost for all 19 subjects. And if you are going with a 1 year plan, you will get 2 months free of cost. This is provided you are using the right referral code. Okay. Thank you so much guys for watching. I hope you guys liked the session. And I think we are having the next session tomorrow itself. And I'm trying to have 1.5 hour of daily learning as opposed to, having very long sessions in a single day. So you keep on learning every day a little bit of histology with me, and I assure you that everything will go well. So tomorrow we are having a lecture on adipose tissue, right? That is fat. So tomorrow's lecture is on adipose tissue at 5 p.m. and you guys can follow that lecture tomorrow. All right. Thank you so much, guys, for watching. You have been wonderful.